All right, let's see what you guys thought. So, Catie, let's see what we got. I see a big T. Maria got true as well. Jeff, that's a T. That's a beautiful drawing. T. And then Nolan had an F for false. There we go. Okay, well, let's check out and see what your answer was. It was true, which I thought was like a great point to come across, that it was 90%. Like, that's such a high value that patients really want to be validated even more than their like physical symptoms. You know, they want like that short-term satisfaction of talking to somebody that cares, and getting that kind of emotional support out of it prior to even having any sort of treatment.
I'm surprised that they admitted that.
Well, it was a focuser too, so they had to like remove them from the setting, right? So it's not talking to the provider saying that like, oh, I needed the emotional support, but like what they were actually thinking was to be validated, essentially, over even more so than their their physical ailment.
In the practice that I'm a part of, I'm not in it daily, but we actually coach and train on this with our doctor all the time. We call it the life effect or life impact. Somebody will live with pain forever. It's only when that pain precludes them from doing something that they want to do. Now, if somebody that works out 3 times a week, 2 days of pain might be enough because they're like, I missed a workout. Most people, how long have you been dealing with this? 10 years, 20 years, 30 years, 5 years. And we always tie every single aspect. We find life effect out as the like, I could actually care less about the location first. I actually care about the life effect as the number one thing. And then everything we do, from an examination, from an OPPQ or ST, from a care and treatment plan recommendation to get to yes, I don't mind talking kind of salesy terms, all of those things always directly tie back to the life effect in terms of our conversation, so that the patient can understand that there's a clear path to what they want. And that's what we always say, our reputation is built upon 2 things, your goals and our findings. And that's also how our care plans are created. The findings we get on physical examination and your goals matter, because your goals might be dramatically different than what we have as goals as a provider, right? As a provider, we see all of these things. We're like, oh my gosh, this, that, and the other thing. And the person's like, dude, I just want to do this one thing. And that's often when patients ghost practices, or a lot of doctors, I could go on and on this. I won't, but that's a majority of the problem, in my opinion, specifically in the chiropractic realm. But actually, we're better than most other healthcare. Most other healthcare is so atrocious. Just not being horrifically bad at it makes you better than everybody else. Chiropractors, I think, tend to still be worse at it than they should be, because we focus so much as chiropractors on the clinical aspects of care and not as much on the conversational aspects of human beings, because often doctors feel like that's sales and they get turned off when it's actually part of being an own human being. But that's my take.
Thanks for tuning in to this episode of Trust Driven Trivia, brought to you by Trust Driven Care. Imagine a world where all your patient communication is in one place, seamless, effortless, and on autopilot. That's the power of Trust Driven Care. If you're ready to streamline your practice, check out trustdrivencare.com and see what's possible. Join us next week for more laughs, new guests, and fresh questions that turn medical research into pure fun. Trust Driven Trivia, making healthcare knowledge exciting, one question at a time.